This is the sternum. These are all the ribs, okay, 1st to 12th rib. My dear friends, I'm Dr. Vaishali Bharambe, Professor Anatomy. Thoracic wall part 1, which is the topic for today. So as you can see, this is the rib cage, okay, the sternum, okay, and you can see these are not bones, right? These are costal cartilages. So let's talk about the boundaries of an intercostal space. We know we can call it typical if it's 3rd, 4th, 5th, 6th. So now I'm going to keep this image for you, okay? This is upper rib, this is lower rib. And these are the muscles and blood vessels in that space. Upper boundary is formed by the lower border of the upper rib. Lower boundary is formed by upper border of lower rib and related costal cartilage. This green image that you are seeing here is the intercostal space. It contains muscles, it contains blood vessels, it contains nerves. So anterior end is formed by the sternum. We'll first draw the vertebra. Here's your heart-shaped thoracic vertebra, the vertebral foramen, the transverse process and the spinous process. Here in the front, we're going to draw the sternum. Now our job is to create the muscle. Remember, the muscle is quite fleshy behind and then becomes quite thin, and here's the membrane. The internal intercostal, as you recall, this is very fleshy anterior. Posteriorly, it becomes very membranous and fuses with the costotransverse ligament. So we're going to draw the costotransverse ligament in green. The innermost layer, there are 3 sets to this layer: a subcostalis, intercostalis intimi, sternocostalis, internal thoracic artery, and the related internal thoracic vein. And there you have a very simple diagram showing you all the intercostal muscles of the thoracic wall. Here's your internal intercostal related superficially to the external and deep to the intercostalis intimi. It takes origin from the floor of the costal groove from the upper rib to the middle of the upper border of the lower rib. So with this, we completed the intercostal space and the muscles there. We still have to discuss nerves, arteries and veins, but I have a question for you. Were you to put in a trocar or a needle into the patient's chest, would you put it along the lower border of the upper rib or the upper border of the lower rib? Upper border of lower rib, of course. Why? So if you're enjoying this lecture, do please like, share and subscribe to my channel and hit that bell icon.